Dr. Sanjay, whole genome sequencing of tumor cells could help predict the prognosis of a patient's cancer and
Yeah.
offer clues to identify the most effective treatment, suggests an international study. In other words, genomics is providing insights into how an individual's cancer might progress and its likely response to the treatment. However, do you think it is cost effective?
Before I come to that question, I think you have raised a very important point. Genome sequencing is going to be the future of diagnosis and treatment. And it has come into a big way in some cancers, yet to come in some other cancers, but it's going to be the future. If I take a few examples, for example, in breast cancer, though not my area of expertise, but in breast cancer, you have the BRCA gene 1, BRCA2. They have now come into the vogue, and if people have this, there is a high chances of recurrence, and these are the patients who need to be followed up very closely. We have the story of Angelina Jolie, who had a prophylactic mastectomy done. That may be a bit too far-fetched, but still patients need to be followed up. Now, in my field, if you take colon cancer into the picture, there are a number of gene sequences which are there, which are available commercially, which help in predicting how the disease is going to go ahead, how the disease is going to progress. For example, if you have a particular gene sequencing positive, you will know that this cancer is going to be very aggressive. And even if the cancer is in an early stage, you would treat them very aggressively with chemotherapy after surgery. Similarly, certain gene sequencings indicate that the tumor might not be responsive to chemotherapy, might not be responsive to particular drugs like cetuximab and bevacizumab. And in these patients, even if they might be a slightly advanced cancer, you would probably avoid giving them unnecessary treatment.